This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to PM&RRecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Very good.
Perfect.
All right. So, thank you all for inviting us to come out. We're talking about the Texas Tech PM&R program. Here's the basics. So we're located in Lubbock. We are not yet an accredited program, but we've sent our application in, and we're anticipating some good news in mid-December. We're going to start off in July 2023 with 2 PGY2 slots and 2 PGY1 slots. From there on, it'll be a categorical program, but we will know in mid-September if we get the green light from the ACGME. We're located in Lubbock, Texas, which is West Texas. And I think that one of the nice things about this program is that it's super affordable and easy to live here. And so if you're somebody who has a family or thinking about it, I think this is going to be an easier place to do that than some of the larger cities. And the kind of the goal, the reason we're here is to kind of train the PM&R workforce to care for folks with disabilities in West and South Texas and the Mountain West. And so a lot of PM&R programs are located, in the East Coast and the more urban areas. And we see a lot of patients. I see a lot of patients in my practice who can't get access to that sort of care. And so we're really looking for folks who are interested, in, maybe someday staying here in West Texas and taking care of folks, or going to some of those places in Arizona and the Rio Grande Valley and places that are underserved from a PM&R perspective. Living in Lubbock, and so if you're into college sports, that is a big deal here, and plenty of opportunities. Outdoors, you can take all those New Mexico slides and just put those into this presentation because it's a 2 or 3 hour drive to New Mexico and Ruidoso and those areas, in addition to some lakes around here and some really great hiking. The other thing that I didn't realize when I came here 14 months ago to start up this residency is that you can have lunch anywhere in the country. There's an airport, Preston Smith, that connects through Dallas and Phoenix and a couple other areas. And because we're so centrally located, you can get some cheap tickets to go pretty much anywhere in the country, which is kind of nice. Salaries, here you can see the salaries. And what I would argue is that the pay is competitive and the cost of living is less. We're going to have moonlighting opportunities. So I think that, if chipping down on your loans is something you want to do, that might be a little easier to do here than it would be in, some of the larger cities. We've got health insurance, vacation, all of that, sick leave, kind of pretty routine and in line with the ACGME standards. One of I think the strengths will be that for those folks who match in the PGY1 is we're going to have a intern year that's kind of a nice cross section of what you need, to do PM&R. Our training sites, Trust Point Rehabilitation Hospital of Lubbock is the training site. I think one of the things that folks will find, as we get this started up, is this is very much a more of a private practice rehab model. So you're not going to get called in the middle of the night for colace orders. It's a little bit more efficient. And I think from what I'm hearing from the students who are rotating with us, a really great learning environment, and maybe a little bit more efficient than some of the more academically oriented inpatient centers. Texas Tech Physicians is a multi-specialty practice. So we'll have sports medicine, orthopedics, geriatric exposure there. Covenant Medical Center is our teaching acute care hospital for consults. Moody Neuro Rehab Institute of Lubbock is there's nothing really like it in any other PM&R program that I'm aware of. It's a kind of that bridge between when you leave inpatient rehab with a spinal cord injury or a brain injury and reintegration into the community. It's funded by the Moody Endowment. And so there's just amazing resources for brain injury and spinal cord injury that can be brought to bear there. So those are places that you get excited about. Definitely take a look at us. Covenant Children's Hospital will be some of our pediatric experience. We have a Veterans Affairs experience, which is really great. That's a population that loves to have residents and is nice because it's a little bit slower pace, so there's more time for teaching. Lubbock Spine Institute, they have a ACGME accredited spine fellowship and a more fast-paced practice. And then University Medical Center will be a place where we'll get some of our PGY1 intern year experiences. Here's the basic idea. And so we've made a conscious decision to kind of string the inpatient and the outpatient through all 3 years. And so it's not the sort of program where you do your inpatient, your PGY2, and then you're kind of done with it for the rest of the residency. We're going to have EMG in that PGY2 year. That happens to be my passion, is neuromuscular. And so I'd like to think our training in that is going to be pretty good, in addition to our training in neuro rehab when we get this thing off the ground. Nuts and bolts, our medical record, ELPIC, WellSky, Cerner, CPRS at the VA. Call. So the nice thing about this is that, the call we do is going to be, for the educational and not the service. And so starting out, we're not going to be doing it any more than every fourth weekend home-based call and no more than 4 times per month weekday home call. And our other faculty member, Dr. Zhang, and I will be taking this call until you all get here. So we're going to be very excited to see you all when you come. Elective time, we'll have 3 months of elective and selective time. And so I think one of the nice things is that this program runs right now. Our clinics, our inpatient services run without residents. I think what you'll find is if you come with us, you're going to have a lot of room to go with those passions, either clinical or QI, research, service, whatever those may be. Our curriculum will have 2 hours weekly of core topics, TBI, amputee, and stroke on an 18-month cycle. And then one of the exciting things, at least for me, is we're going to have some longitudinal topics. We really want to make sure that y'all are feeling comfortable taking over as a medical director at an inpatient rehab facility and really leaning into those systems. So we're going to have a lot of that. Wellness and resilience, diversity, equity, and inclusion, and research. Those will all kind of be threads that go through the curriculum. We'll have weekly anatomy, EMG, ultrasound conferences. We'll go through all that neuromuscular stuff, all the anatomy. And then we have a sports medicine fellowship and a pain fellowship. They're in different departments, but during the PGY3 year, we'll have you do all the didactics with the sports medicine fellows, and PGY4, you'll do all the didactics with the pain fellows. And so I'd like to think that y'all will be really well prepared for your board exams, having learned things at kind of a fellowship level before you leave here. So, I guess the elephant in the room is, goodness, starting a new program, that's a little bit courageous. And here's the reasons I think y'all should give us a look. So I think neurorehabilitation and general inpatient rehab, those are going to be strengths. And I think we're gonna have you all prepared for that. Neuromuscular electrodiagnosis and neuromuscular ultrasound. One of my goals is that, there may be folks who can figure out where the lesion is, who can do EMG and neuromuscular ultrasound as well as us, but nobody's going to do it better. Y'all are going to be very comfortable localizing those lesions and being willing to take on the cases that the last 10 physicians couldn't figure out. We're going to have it be in person. During COVID, I've kind of come to the conclusion that connectedness is so important. And my teaching style and the teaching style of the faculty is very much in person. You know, we may have guest lectures zooming in, but we'll be sitting there with you, and it's going to be a very interactive in-person didactics. And so if you're wanting to do your entire didactic curriculum, Zoom lectures, sitting at home, this isn't the program. This is going to be an in-person sort of thing. We'll have protected lecture time. We have an excellent team of nurse practitioners and PAs. You know, our vision for the program is they take the pagers so that when it's time for education, y'all are there taking that on. We will have moonlighting opportunities for the PGY3 and PGY4 year. So you do a good job during the PGY2 and you're meeting your milestones. We'll have opportunities for y'all to get some extra cash there. Lots of autonomy. You know, during my training, I used to find that faculty kind of got in the way. And so I think that we're going to have a sort of culture where y'all can really take ownership of your patients, and not just in the clinical space, but being able to really design your residency experience. I think there's going to be a lot of flexibility built into this. Education will be prioritized over service. And then I also think the ability to impact the culture of the program and the department. You know, whoever comes with us is really going to set the tone. And I think Dr. Zhang, myself, Dr. Wilcott, we're going to be very interested in your feedback and how we can improve this. And so I think there's going to be more of an ability to kind of design a residency, you know, in partnership with the faculty than you might have at some more established programs. And then the final thing is the people here are just awesome. I've lived a lot of places in my life, and I have never found more awesome people than the folks in Lubbock. They're just nice, salt of the earth people, welcoming, and the cultures at the institutions that we're standing this up, Trust Point, Covenant, Tech, it's just a really, really good environment. And I feel bad that the interviews are going to be in Zoom, because I think that would have been one of the strongest points of that. But hopefully y'all will be able to connect with some of the students rotating with us now, and they can back us up on that. Roger Wilcott here, the guy in the upper left-hand corner, this residency has been his dream for 20 years. And he is just so passionate about this and wants it to be successful. And so that's my little spiel that I have. I guess we can have the rest of the time to have a discussion.
Awesome, Dr. Norberry. You got about 8 minutes to answer some questions here.
Great question, Amanda. What opportunities will there be to work with medical students? I was actually thinking of that today because we had a whole bunch of medical students doing some teaching. And one of the things that I'm hearing from your future employers, you know, the inpatient rehab facilities that want to hire y'all, is that they want medical directors who can teach their staff. And so I think that I don't know exactly what form that'll take, and it'll probably be individualized. But I can tell you the tech students are super excited about this residency and wanting to learn. And as this evolves, I think that having the residents take a leadership role in that is something that not just serves the residents, but serves you. If you can teach something to a medical student, you know 90% of it. And having been in medical education for 12 years, there is a direct correlation between how much a resident leans into medical student education and how well they do on the boards. And so I think that's going to be a huge piece of this program. Oh, wow. So many questions here. Let me make my chat screen bigger so I can catch them all. What patient populations, pathologies do you feel your program will offer unique exposure to? I'm going to say neurorehabilitation, and by that I mean traumatic brain injury. I think that we're gonna really lean into that, and then I think the neuromuscular patients, and so by that I mean patients with, you know, focal, you know, mononeuropathies, radiculopathies, those kind of difficult to diagnose patients where, is it a pain complaint? Is it rotator cuff? Is it, you know, C5? I think that's going to be something where we're going to have some really great exposures. Next one, what types of candidates are the program looking for? I'm really looking for folks who are really interested in taking care of patients with disabilities. Folks who are really looking to lean into that inpatient rehab experience, looking to care for those vulnerable populations, and looking to do so in a way that's not just in the clinic, building ramps on the weekends and things like that, really being champions for this population. Next one, Naomi, will we be able to apply through ERAS prior to accreditation? My understanding is that we will hear on mid-September and the applications open on September 19th. And so I think that timing is going to work out okay, but certainly be in touch with us as you go through the process. Will the program accept applications for IMGs? So I came from East Carolina University. We had some incredibly strong international medical graduates there, some folks coming from the Caribbean schools, and so we welcome those applications. And holistic approach, I think that's what we will do, is a holistic approach. Thanks for the great presentation. Audition rotations are available, and so I would reach out to Elena Garcia. For that, we do have some slots for this fall. Will there be opportunities to work with TTU athletics? I think absolutely. I think that we'll have our sports medicine fellowship. We have some connections with the Covenant folks, and I think those opportunities will absolutely be there. Apart from accreditation, what are one or two obstacles you see for starting a new program, and how do you plan to overcome them? Let's see, obstacles. So I think one of the biggest obstacles we have is faculty. And so Kyle, what I want you to do is I want you to come here, go through the residency, and then I want to hire you so we can solve that problem. And so I think that's a barrier. I think the way that we're overcoming that is by utilizing resources, external and internal, to overcome that. So for example, didactics through the Association of Academic Physiatrists, other departments, neurology, orthopedics, and all of that. And flexibility for you all to lean into those things that you're most interested in. I think another barrier that we'll have is because we don't have a whole lot of academic faculty yet, would be research experiences. And so our newest faculty, Dr. Zhang, has a lot of experience in that. And so I think that by the time we have this thing stood up, we'll have more research opportunities within the department, in addition to the very robust research enterprise through health professions outside there. Let me see here. Any opportunities to work with orthobiologics? So Colton, the VA has a podiatrist upstairs who has all of these cool things in boxes that we can inject into veterans, scaffolding and things like that. And I've been so busy building a residency for you that I haven't had an opportunity to go up there and inject them into veterans yet. And so hopefully that's something that y'all will help me with. And then sports medicine, I know, is doing PRP. I've done some sclerotherapy in the past and looking forward to getting back into that. So I think that's something that will grow. And if we can't find it, in the department, we'll find ways for you to get outside of it. Is Lubbock bicycle friendly? Do any of the staff bike or cycle to work? So Dr. Patel, I biked to work my first day, and because I have 7-year-old twins, I haven't done it since. I would be lying to you if I said it was safe to bike to Trust Point, but some of the rotations at Covenant and Health Sciences Center are safely bikeable, and I think there will be opportunities for you all to do that. Can visa requiring IMGs apply to the program? I think that the unfortunate reality with PM&R is that it's become very, very competitive. And so we welcome all applications, but I don't know that that's going to be a high chance of success at this time as we're starting out. Email for Elena Garcia. Let me see here if I can go back to that. Resume slideshow. From current slide. Can you all see Elena's contact information there? Let me see here. Yep. Okay, great. That's her. She's the program coordinator. She is the gatekeeper to all of that. Oh, and Elena's here. Hi, Elena. I'm so happy you could join us. Okay, let me see here. Next question. How much exposure to the VA and or prosthetics, orthotics does your program offer? And so I would anticipate that by the time we start up this residency, we'll probably have 3 or 4 half days of experiences. And we are in the process of starting up a amputee and wheelchair clinic there at the VA. And so that'll be a part, both of those things. In addition to that, we have an experience at one of the orthotists prosthetists here who's really great. And so that person will be on faculty. And of course, we'll have the inpatient amputee exposure after acute care. Naomi, excellent question. Do you have opportunities for cancer rehabilitation? So I think that's an area that we're looking to grow into. We don't have that faculty member yet, but we do have both of the hospitals starting up cancer centers, and I think that's going to evolve as time goes on. Wow, that was a lot.
Awesome. Thank you so much, Dr. Norbury. You crushed a lot of questions there and gave a lot of great information. We really appreciate you taking the time to present with us tonight. And if there's anything we can do to help spread the message about the things going on with the program, please let us know. At PM&R Scholars would be happy to do so.
Follow us on social media. So thank you so much.
No problem. Take care.